that was quite the intro. Good evening. It's great to be here. And as Femi mentioned, I represent a large group of scientists whose job, or goal, I should say, is to try to get all the world's data together and quantify all the major diseases and injuries around the world, and what are the major risk factors that explain disease, and communicate that quite broadly. So that effort has three big parts. One part is finding all the data that's either in the public domain, in published articles, and surveys, and censuses, in administrative records, and often data that's not publicly available. We negotiate access to it. We catalog it, and we put it into something called the Global Health Data Exchange, which is the largest online catalog of primary data that exists. But data is really messy. Every country, every study is often a little bit different than others. When we look at one disease that's related to diabetes, there are 23 different case definitions out there. Death certificates are filled out in different ways in different countries. So the very messy nature of data means that there's a lot of work that goes in, and that's why it takes 1,100 people, to try to crosswalk across all the case definitions and actually make a coherent data set. And then the third part is to try to visualize it, because it's not that useful to have enormous tables of data unless we can explore it and give access to it more broadly. And in fact, just to give you some numbers about how large this undertaking is, there's about 50,000 different data sources that go into this effort. One data source, for example, would be a country's vital statistics, and that may come in lots and lots of detail, but we count that as one. There's about 50,000 that go into this. We produce about 25 terabytes of data every time we run this study. And what's interesting for today is that it's now an annual process, so we annually update these numbers. And this is the first public showing of the results around diet and disease. We've shown results for other components during the course of the year. So let me start with this little diagram, very colorful. And what it starts is one of the central themes about health globally. That is that life expectancy and any measure of mortality, whether it's death in children or death in adults, is generally improving. Few exceptions, but largely improving. So in this diagram, we're comparing 1990 to the colored bars. At the far left is where life expectancy was in 1990. Far right is where life expectancy is in 2013, the last year for which we have made estimates. So if you're here in Sweden, good news, life expectancy for women's already up to 83. Similarly in Australia and Singapore. I've just picked a few countries here. And this tool, by the way, which is online, you can pick any countries, make any diagram you want instantaneously. And then you have other places like India, where life expectancy is only up to about 69 for women. If we look for men, it's not as rosy. So if we sort of take the same set of countries and look, you find that the ordering of countries is sort of similar. Russia moves down for men. Male life expectancy only 66. But here we have the same folks at the top: Singapore, Australia, Sweden, and other high-income countries. But the main story there is the shift, that we are seeing progress even in places that had large HIV epidemics. We're now finally into the period where access to antiretrovirals are making things better. Well, what about what's explaining this? And here's where we get into the part that's most relevant to this audience and to this critical discussion around food. We try to measure what people eat and how much they smoke and how much they drink and other risk factors that drive patterns of disease. We take the published knowledge about how bad it is for you to be exposed to these risks and put it all together and quantify for every single country how many deaths and other metrics as well can be attributed to different components of exposure or risk. And diet is at the top of the list, interestingly. And I'll explain what I mean exactly by diet. It accounts for almost 11 million deaths in the world, followed by high blood pressure, then tobacco, then air pollution, obesity, another food-related outcome. And even we still have, as we were discussing earlier today, malnutrition killing just under 2 million children a year, which is the spectrum from not enough to too much food in many respects. Now for diet, we can actually look at the components of diet here. And so diet's a broad basket, and we actually look at specific things for which there's sufficient evidence to make these sort of assessments. So the most important factor for diet is actually high sodium. then low fruit consumption, low whole grains, low vegetables, low nuts and seeds, on down the list to things like high red meat down at the bottom there. So lots of important information. This ranking looks different in different countries. And if we just go back, and I'm going to show you two of these at once. So the one on the top is 1990, and the one on the bottom is now 2013. And I just show you that view because in almost every case, particularly for sodium, fruit, whole grains, the number of deaths attributable to these diet deficiencies or excesses is going up. And that's partly population growth, it's aging of the world's population into ages where there's non-communicable diseases, and also that those are part of the reason for these drivers. Now, just to point out that if you change views from counting deaths to counting years of healthy life lost, diet still stays at the top here. This is a comparison of ranks of importance in 1990 to 2013, but malnutrition shows up as number 3 because people who are dying as children are losing most of their lifespan. So if I can switch over to the PowerPoint. What I'd like to do in the last few minutes of this presentation is talk to you about the future. And so what we've done is a little bit of starting from 2013. This is a map of how many years of life expectancy could be added in each country if people shifted to an optimal diet. And it goes up as high as actually 7 or 8 years in Central Asia. In most places, it's in the 2 to 3 or 4 years of loss of life expectancy. Now, if we think forward, what we're starting to do to try to help people think about the importance of diet and other factors is to make 25-year scenarios for the future of health. And there's a lot of sort of complicated machinery behind this. There's both a sort of statistical, analytic baseline for every single disease, for every country, with drivers that range from climate change and economic growth. And then on top of that, we're trying to figure out the various scenarios. And I think that's where it gets interesting, if we can start to trace out how different food scenarios might change the course of future health. Now, one thing we do know from any of the modeling, ours or anybody else's, the World Bank, the IMF, OECD, and other groups, the Australian Treasury that do long-range forecasting of income, the world will be richer. This is one of many possible scenarios. It's the sort of expected value scenario. But in addition to lots of countries being richer per capita, there will still be a whole bunch of places in the Sahel and Central Africa that are actually quite poor on current trends. But that increased wealth and education in most places will drive a lot of health change. And unfortunately, although it's going to make lots of improvements in the environment, in terms of water and sanitation, in terms of air pollution most likely, at least in some parts of the world, for diet, there isn't, on current trends, going to be that big a change. These lines show the global risk associated with each of the top 5 diet components. So whole grains, no improvement, but there will be some improvement in fruit and vegetables. Red meat's going to get worse on current trends. That's the green line going up, and salt will stay about the same. So although good news that world's getting healthier, the potential to improve things through improved diet is actually rather dramatic and is not going to go away anytime soon. So to close, I think there's a very powerful connection between the drivers of future health, climate change, economic growth, educational attainment, health system expansion, and the whole nexus around food and diet, both in terms of eliminating malnutrition, but also this enormous potential to add probably 4 or 5 years of life expectancy in the future to the world if we could shift the world progressively to optimal diets. So I hope this little taste of data was useful. These things are online. We make these online data visualizations for people to use, to play with, to retweet, recycle, and hopefully will feed into your thinking and planning for the future. So thank you very much.